When New York City stopped, you kept going. You were on the front lines working to keep us safe, working so we don't run out of food, and ensuring New York City can continue to stand in our new reality. Here at Somos, we have always been by your side. And now that our city is opening up, we are working tirelessly to keep you and your family safe. Now it's time for us to keep our children safe as we get ready to head back to school in these uncertain times. We are working to ensure that the future of this city, our kids, can resume their studies in a safe and healthy manner. We will work with community leaders and elected officials to create a reopening plan that keeps everyone safe. By ensuring that our communities can stay healthy, we are ensuring that New York can continue to recover.
Good morning. I'm Denise Nunez. I'm a pediatric intensivist. And as a pediatric intensivist, I lived frontline how the health disparities in our community increased the infection rate, increased the number of admissions we had in the ICU, and also increased the deaths in our community. Under the guidance of Dr. Ramon Talaj at Somos Community Care, all of us, 2,500 pediatricians, went on the front lines in the communities. We served our patients. We opened test sites. We tested over 340,000 patients through walkthroughs and through drive-throughs. But the most important part of the walkthroughs is that we all opened and kept open all our practices to serve our community. We kept them educated, we fed them, and we tested them. This communication that we kept with our students, we want to keep it. We want to make sure that we keep this bidirectional communication with our nurses in the schools. For this reason, Somos Community Care will cover the cost of implementing computers and programs in all 500 schools in New York City. Thank you. This will assure the bidirectional communication between the nurses and the primary care provider, the pediatrician of our patients. Very important, we were the front line. We understand our patients. We communicated with them. We have to remember that the way that we were able to decrease infectivity was testing our patients, isolating our patients, and educating our patients. So we are the community. We know our community. We know our families, and we know our patients. Who better than us to be partnering with you, with our authorities, to make the right decisions? Thank you.
Thank you. And now for Dr. Nunez. The school chancellor, Richard Carranza, appearing on CNN, said that not every student will be tested, but the city will have random temperature checks. Is this really enough?
Well, with all due respect, one of the things we have to remember is that most of our kids are asymptomatics. So even though you try to randomly check their temperatures, you're not sure who's going to be positive. We must test our patients, our pediatric patients, before they start school. There's no data that we have right now to say the amount, the quantity, how frequent it should be done. That's why we all should sit down at a table and sort of make up a plan. But one of the things that we must do is that we definitely have to test our patients before we go into school. And very, very important, they must go to their pediatricians, their community pediatricians. We have testing sites. So they should come to us. Remember, in the hospitals converted into COVID centers, so they're very scared. They're afraid they're not going to go to the hospitals. They must come to us as general pediatricians in the community and get tested, because we all have our centers open to get tested.
Thank you. And now, Dr. Nunez, you mentioned earlier that some kids are asymptomatic, right? So in these cases, most districts plan to continue to use the temperature check. What is your take based on your experience overall?
So as I mentioned, I mean, they're asymptomatic, and even sometimes if they're symptomatic, some parents can give some medicine before going to school. So you have to be a little bit careful with the temperature, taking of the temperature. So that's why it's very, very important, especially like they were talking about randomizing and all. It's very, very important, and I'm going to just add up to my colleagues here, that we implement a plan where we test all our students. We have to all sit down at the table together and decide how frequent we're going to do this and how we're going to do this. But it is imperative that we give the opportunity of all students to be tested and to make sure that we can figure out who's infected and who's not. Because as you mentioned before, their kids are asymptomatic and they're just go in and they can go back home and infect some of their other family members. So we have to be very, very careful
to test
with that.
their children. Dr. Nunez, what would you say to a mom? What would be your advice to her? She's got 3 kids and she wants to test them all. What's the safest and most efficient way?
So first of all, one of the things that I always encourage my parents and patients that I just meet is that they have to make sure they have a one-to-one communication with their pediatrician. It is very, very important that they talk to them when they have any questions about it. So depending on the testings that you want to do, there's different testings. We have the blood test for the IgG just to see the immunoglobulins, and also the testing for the PCR just to see if you have the active infection at that time. So depending, what we would recommend right now is that the patients go to their pediatrician, have a conversation with them. They have to understand, because sometimes they go testing in the hospitals or other places and they don't sit down with them. They don't explain what the testings mean to them. So they do the test and they have no idea. So the most important thing is go to your doctors, understand what you're doing. If you're doing the nasal swab or the rapid test, it tells you right there if you have the disease at that moment, or if you do not have it at that moment. And the blood test will tell you if you created some antibodies against that, some immunoglobulins against that disease. So there's not many studies done yet. But the good thing is the recommendation is that let's test our families, our patients, so later on we can create studies and we can come with some conclusions regarding vaccines, regarding immunity. If we don't have those studies, we won't be able to sit down as a scientist that we are and create controlled studies to define what they mean.
Thank you. And this question is for you, Dr. Nunez. How long do COVID-19 test results take to come back? Why do we hear someone say, I had it done 10 days ago, I'm still waiting, and someone says, I just got it 4 days ago and I already know?
Yeah, so that's one of the most important things, that we should actually have our labs and sit down with them on the table to discuss with them, because if we want to have effective tracing of who has it, and so we can make sure we trace the person that doesn't infect somebody else, we should have it within 24 hours. But in reality, accurately right now, we're not having it. We're having it about a week or 7 days or more than that, even 10 days. So we need to sit down with them on a table and sit down with the laboratory companies so we can work a better process of making sure we can get the results in a faster time in order for us to do the tracing a better way.
Awesome.
It's very important that we educate our children, that the parents create trust with their kids, and depending on the age level too. So you cannot treat it like a teenager as you treat a little kid. So you have to talk to them on their language, on their age, and make sure they trust you, they understand what's going on. You have to be clear with them, making sure they understand what is a virus, what's causing it. So they have to understand. The more they understand, the clearer they are, they're going to take better actions, as the lady that did this social distancing.
So trust.
So I think that is trust, and education is the most important thing, as Dr. Molina said. Anybody wants to add?
My question is, if a student comes in contact with another student who has tested positive for COVID and they have to quarantine, does the whole household have to quarantine, or just the student?
So if a student comes in, and I just want to make sure you're faced, if a student comes in contact with somebody that is positive, and that student already went home and sort of got in contact with everybody in the family, the most important thing is first that you need to contact your pediatrician, right? Talk to the pediatrician so they can guide you. But whoever has been in contact should be tested, and then we can figure out if they were positive or not. And in the meantime, they should be in quarantine.
Thank you.
Yes. We want to make sure that our parents, that our nurses keep a bidirectional communication with all the pediatricians of our patients, and that when somebody is sick, one of our patients is sick or presents any symptoms, they're able to contact us right away so we can do testing. I'm pretty sure all of you or some of you have kids, right? And you already tested your kids? So I tested mine, and I want to make sure that all the kids are tested before they start school, and that we make a plan together to see how frequent we need to test them.
Ladies and gentlemen, thank you for joining us today. Don't forget, be safe, wear your mask, social distance, and we'll now continue any press interviews. Thank you for joining us.